What do you like? Tell me what you like.
I love the idea of nourishing both our body and our soul.
Welcome to the Nourishing You podcast presented by the National Association of Nutrition Professionals, NANP. We invite you to join Kristen Burkett and Diana Wally as they host experts from the holistic wellness space who will share practical tips and information to enhance your health and vitality. Kristen and Diana are master nutrition therapists and board certified in holistic nutrition, with private practices that support their clients as they strive to reach their full potential. If you enjoy today's show, please help us out by commenting below, liking this video, and subscribing to the channel to help us spread the word.
You have to move your body. That's my message. That's my passion.
This episode of the Nourishing You podcast is brought to you by Leucofix.
Hi, everyone. Welcome to this episode of the Nourishing You podcast. Today, we're diving into a topic that so many people experience but often don't fully understand, and that's reflux and GERD with our special guest, Dr. Spencer Payne. Dr. Payne, MD, is a board-certified otolaryngologist specializing in rhinology, sinus, and endoscopic skull base surgery. With nearly 25 years of experience in medicine and 19 years at UVA Health, Dr. Payne is a recognized leader in his field. His approach combines cutting-edge surgical techniques with a deep interest in functional medicine, emphasizing nutrition and lifestyle modifications for long-term patient wellness. He has co-authored national guidelines on sinusitis, nosebleeds, and balloon sinuplasty, and frequently contributes to professional forums and thought leadership platforms. Passionate about improving patient outcomes, Dr. Payne is known for his curiosity, problem-solving mindset, and ability to translate concepts into actionable insights. Thank you so much for being with us today, Dr. Payne.
Thank you for having me. I'm excited to be here.
Yeah, we're also very excited to have you with us today to unpack reflux and GERD, which affect millions of people. But to kick things off, we'd love to learn more about your background and how you decided to take a more natural approach to patient wellness.
Sure. Yeah. So a lot of that honestly comes from some of my own personal explorations through my own health and disease. My father actually passed away when I was in college from a heart attack. And I was kind of a young age at 49. And so I think I just turned 50 myself. And when I was turning 44, I kind of was sitting there thinking wow, I'm only 5 years from when, my father from a lifetime of bad diet and habits, eventually succumbed to that kind of. I thought, well, I've really got to look into how to treat my body better. And you would think even as a physician at that point, I would have thought, how to incorporate a lot of those things into life. But I really started thinking more about it. And the more I started to read and look at it, I began to even more appreciate how our allopathic medical training is really kind of symptom pill, a type of thing, as opposed to really getting to the root cause of things. And that's when I really began to look into, okay, well, what is it, what we're doing? What about the diet? What about behavior? What about activity? What are the multiple ways to approach this type of problem for both myself and my patients? And the more I was learning more about this and learning about functional medicine as patients were coming to me and saying, I can't just be on another pill, or, is this going to fix me, or are you just treating a symptom? And I realized that I really do, and we all do, need to kind of approach patients, not only where they at, meet them where they're at, but then also provide them these tools to heal themselves. And it's, more than just a drug should be used to, in certain circumstances, drugs absolutely have to be used. But for a lot of instances, I think it's about getting somebody some relief while we learn how to kind of heal the body in different ways through any multiple different things. And so from a reflux standpoint, that started coming up, very early on, just with a lot of what I do in the sinuses and the number of patients I see with post-nasal drip and nasal drainage. And I was like, there has to be a better way, since all these patients are just going on, PPIs or all these types of things. And that's when I really started thinking, how are we gonna get you better?
I think number one, I just want to say I really appreciate that as a physician, you were open to, because not everyone is willing to do that. And so we love that you've added to your skills and been willing to look for deeper ways, deeper approaches and different ways of addressing things with people. I think that's fantastic. I hope we have more physicians that will follow along in that path as time goes on. So as you said, like reflux and sinus drip, there's so much of that going on. Can you tell us more specifically, just to get our audience all on the same page, what is that? And what's the difference in, say, the different types of reflux that might be out there? How does it relate to something like heartburn or GERD or silent reflux? Like there's so many terms that seem to be related to the same thing. Can you kind of take that apart for us?
Yeah, right. Yeah, it's a great question because there's so many terms that you just alluded to. And so I'll just kind of like smatter a bunch of them out so we can kind of get them out of the way in terms of like there's heartburn, there's people have heard of GERD, reflux, silent reflux, LPR, laryngopharyngeal reflux. There's NERD, here in Europe it's NORD. We'll get to that in a second. And all of those things. So I guess if we think about it more from a orderly standpoint, from like big to small, right? So reflux is simply the movement of stomach contents in the wrong direction, right? We're supposed to eat food, food goes down your esophagus or your food tube, goes into your stomach, stays in your stomach, gets digested, starts to move along. However, if something happens in that process and instead the food or the stomach acid or stomach enzymes go in the reverse direction and go from the stomach to the esophagus, that's the reflux. If reflux is continuing like all the time, and it's a frequent occurrence, it's happening often, and there's symptoms, then that is when you get gastroesophageal reflux disease. So in essence, that now becomes a kind of pathologic recurrent thing. And reflux can be a normal occurrence. It doesn't cause issues, but when it's happening repeatedly, that's when, in essence, it's more of a disease state because it's continually occurring. Heartburn is a symptom of reflux. And so if the acid in your stomach then causes irritation in the esophagus or your food tube, then you get that heartburn, that burning sensation, either like kind of the top of your stomach or deeper in the chest where the acid is acting. Heartburn can be one of many symptoms of reflux. And as an otolaryngologist, ear, nose, and throat surgeon, we're treating a lot of times the symptoms or what we call extraesophageal symptoms when the reflux is causing issues either in your throat, maybe your nose, maybe your voice box. And so we're seeing patients who have postnasal drip, cough, hoarseness, throat clearing, and even sinusitis. There's been studies that have linked and associated, difficult to treat sinusitis, sinus infections with reflux occurring. And so now you've got symptoms, postnasal drip or heartburn, which can indicate that reflux is occurring. When the reflux comes beyond the esophagus, now it's extraesophageal reflux, or what we also call as laryngopharyngeal reflux. And then, for lack of a better word, so that kind of makes more sense to the average person, we call it silent reflux. It's not making any noise, but because it's absent that heartburn symptom that everybody else goes, oh, well, I don't have heartburn, so I don't have reflux. And you have reflux, you're just not having the heartburn because it's silent to your esophagus, so to speak. You can also have kind of heartburn or dyspepsia, which is kind of like that stomach discomfort, even with low acid or no acid. You can have functional dyspepsia where there's maybe even no reflux occurring, and then you actually have stomach symptoms. And I think that pretty much covers all of that.
I think you said LPR. What does that one mean?
Oh, yeah. So LPR or laryngopharyngeal reflux, which again, that's kind of then also synonymous with extraesophageal reflux, or in essence, the acid, enzyme, or pepsin, or bile salts, anything that's been in the stomach actually gets all the way up the esophagus and into your throat.
I would bet that many people listening didn't know that post-nasal drip and sinus symptoms can be associated with reflux GERD. But I'm curious, what's the connection there? What is
It's a couple. Yeah, yeah. It can be a couple different things actually. There was actually kind of an interesting study that was done in Australia where they actually put both saline, salt water, and acid just in someone's like lower esophagus. And just doing that, basically stimulating the lower esophagus without the person having eaten anything or swallowing, more or less kind of simulating a reflux event. And that triggered nasal congestion and nasal drainage. So reflux alone can actually just trigger the nose to produce extra mucus and congest. And you can kind of think of it in the sense of the body is sensing that something might be coming up in the wrong direction. So what should we do? We should shut down the nose to protect it. And we should produce more mucus to kind of flood things down the other way. In addition to that, though, if the acid or the enzymes actually come high enough up, then there's a direct irritation. So the acid and the enzymes, the pepsin, may actually be acting directly on the lining of your throat, the lining of your your voice box. It can even get into the back of your nose. And now that inflammation and irritation alone is causing damage to the body's response to produce extra mucus to kind of coat and soothe the area in response.
It's so interesting because I guess I kind of thought that maybe the sinus connection was that the drainage from the nose was triggering the reflux versus it being the other way around. But can you have both, or is it mostly this other direction?
No, I mean, it can absolutely be I mean, it can actually be what you're saying. You can have nasal drainage and a runny nose and allergies or sinus infection and sinus from the sinuses. And people know this whenever they've got a bad, viral respiratory tract infection, a cold, and you're just swallowing mucus continuously. And actually, I was thinking about this the other day when I had a cold, and I was like, wow, I really do feel gross right now. I think it was like the first time I had felt nauseous just for my own like mucus. But a lot of times we'll see patients and, I'll ask them, I'm like, well, do you breathe through your nose? I breathe through my nose just great. Does your nose run? Nope. Allergies? You're sneezing? Issue watery eyes? Nope. But you have post-nasal drip stuff all the time at night. I'm like, right. Well, if you don't have any nasal symptoms and your only nasal or sinus symptoms that you've got the post-nasal drip, and reflux may be one of those things we've actually got to think about. And they're like, well, I don't have reflux, doc. I don't have heartburn. And I'm like, well, okay, let's talk about silent reflux. And there we go.
So you mentioned, I'm thinking about the listener who might be wondering, oh, are there other symptoms, that might even mean that I have silent reflux? So you mentioned coughing, you mentioned the sinus issues. Anything else that somebody might consider, as a symptom of one of these conditions?
Yeah, I mean, so reflux, a lot of times people will complain of like a sour taste in the back of their throat. The hoarseness or like, like a gravelly, rough voice, especially like in the morning. If you've ever had like a real spicy meal or one too many, beers or Manhattans out with the friends, like that next day, you might, have that kind of like froggy-ish voice, like that's because of the reflux. But something, the technical term is globus, but really means like that constant feeling like there's a lump in your throat or like postnasal drip or the constant throat clearing. You're always trying to get rid of that sticky stuff that's sitting there. And all of these can be signs of that silent reflux.
Are people prone to having that buildup overnight? So like that the morning is really difficult with that throat clearing and that frogginess and all of that. But it's better during the day, or is that probably something not so much related to the reflux?
Well, we see different patterns, honestly. For a lot of laryngeal or throat or voice symptoms, there's actually some studies that have shown a lot of the reflux is actually occurring during the day. But we certainly see a lot of patients, a lot of people who are having reflux events at night, and that can be tied to how late did they eat, what was their meal, how soon did they lay down after they had eaten, if they had consumed alcohol or caffeinated beverages, that kind of like weakens the lower esophageal sphincter, the muscle at the the between your esophagus and your stomach. It's supposed to keep things in place. It's like all of these factors add up. So if, you have that Friday night pizza and beer, it's it's like a perfect storm and then you go to bed because you were up late. Yeah, it's that perfect storm for like reflux overnight and waking up, and let everybody knows that you've been refluxing.
I've never done that, by the way. Never done that.
No, me either. I just, I know a guy. Yeah.
I have no idea what you're talking about, actually.
So we probably should kind of circle back and say, why is this such a big deal? Why do we care about the reflux, whether it's silent or not? Like, what's the damage that can come from that, or what's the harm in it?
Yeah, well, quality of life is huge, and I think that's where most people are seeing us. I mean, it's the damage is in essence being done. They're irritated, they're coughing, especially around COVID. Everybody was coming in, I cough. I'm blowing my nose continuously. I'm always spitting up all this stuff. Like everybody thinks I'm infected. So there's the social stigma to that type of an issue, and that's just as damaging as maybe the physical component. You can certainly end up with hoarse voice and difficulty speaking. We treat a lot of people who their livelihood relies on their voice. Professional singers, professional voice users, or service agents, teachers, professionals who are using their voice all the time. Like, so that part becomes very disruptive to their life and their well-being. But, outside of the throat type symptoms, acid reflux is definitely associated with esophageal cancer. And so we absolutely have to be concerned about, the potential for, significant disease. A lot of people have heard of Barrett's esophagus, which is kind of a precursor to esophageal cancer. And what that is just quickly is basically because of chronic irritation and the trauma basically from acid getting into the lower esophagus, the esophagus actually has to change the type of skin, for lack of a better word, mucosa that lines the esophagus to try to protect itself. And that can become so aberrant that in essence, a cancer ends up forming out of that. So constantly having reflux, heartburn as signs without necessarily treating it can lead to other things. Others we haven't talked about because we were just talking about things like the average things, like red flags of you start losing weight, or maybe you're coughing up blood, you're not able to swallow, food's getting stuck, food's getting caught, unintentional weight loss or vomiting, all of these things. These are the bad symptoms that really should trigger like additional evaluation.
We're so glad that you're here to talk about this, because it is something to take seriously, judging from what you just said. So we're so glad that you're here. So switching gears a little bit. So I feel like we now have a really good foundation of the different conditions and symptoms. So we'd love to talk about root causes, like why does this happen? So what's happening, in someone's body? And when you're working with patients, what are some of the most common issues you're seeing behind reflux and GERD?
Yeah, I think probably number one is the sad standard American diet. So much of what we, you are what you eat, right? And so many patients have turned to different dietary lifestyles, and it's what's in our food these days. And so the amount of like the fat in the diet, the amount of, I hesitate to say processed food because that means different things to different people. But if we want to even just be very simple and discuss like the amount of high volume of sugar and fats and other chemicals that you can't pronounce, I think all food at this point is processed to a certain extent, but what gets
ultra processed.
It's that ultra processed where we're adding extra things to make up for the fact that it's going to have a shelf life. Those are the things I think are direct irritants. But and some of that is theoretical, but some of it is absolutely highly processed, high glycemic index sugars and sweeteners are going to make reflux worse. High fat in the diet makes reflux worse because it slows your stomach down. That's why fats fill you up, but it slows your stomach down. And so that makes it a lot easier for reflux to occur. And I think induce a lot of inflammation in the body, and that causes other issues. So if we start to even look kind of, that's almost like there's a direct correlation to that. But then these types of diets also lead to several other things, and that can include, metabolic disorders like diabetes. And then, as diabetes progresses, that in and of itself slows the stomach down. That's going to make reflux worse. Now, if we have metabolic disease plus weight gain, now we've got all this extra pressure on the stomach. And so you're asking this tiny little muscle to try to keep everything in your stomach. But if we're packing on all the extra weight, that's going to push things down even further. And then there's, I think, just the rush of life. I was talking to one of my patients the other day, and I just said, hey, think about like your dietary habits and when you're eating. He's like, not going to happen. Not going to happen, doc. I work from 3 to 11, and then I get home and I've got to eat food, and then I've got to get like my 4 hours of sleep in before like the next thing. And I'm like, all right, okay, I understand. And so I think even just the work day and the stress and then how we kind of shape our lives plays a big part in that. And then we really want to start getting deep in the weeds. I think our reliance on screen time is probably making things worse for us. The technical term is aerophagia. Yeah, where in essence you're just eating so fast, you're swallowing all this air and causing a lot of stomach bloat. And it's mindless eating while you're just, staring at your phone or your TV or your screen. I remember when I was a kid and we would, it was like a special day. We'd put out the TV trays and the little, have our little dinner in front of the TV and watch the show. And it's like the whole thing, special thing for the family. And that's not a special thing anymore because everybody's just, if you can't tell, your whole family's got like something in their hands. You see groups of people in restaurants and they're not talking to each other. They're just looking at their phones while they're like gobbling down the worst fast food you can probably eat. So
Leucofix is a clinically informed health company focused on supporting speech and cognitive development in children with autism spectrum disorder, ASD. Their work is grounded in emerging research around folinic acid, leucovorin, and its role in cerebral folate deficiency, a condition commonly observed in children with autism and associated with language delays. Developed in collaboration with clinicians, Leucofix provides an accessible, over-the-counter formulation of folinic acid designed for families who may not have easy access to prescriptions or insurance coverage. Their mission is to bridge the gap between clinical research and real-world access by empowering providers, practitioners, and families with safe, science-backed tools to support developmental outcomes.
What was the term you said again for the air?
Oh,
Air?
aerophagia.
I've not heard that one yet. That's an awesome term. Okay.
It is.
Yeah. What role do you see the nervous system playing here, like a connection with stress, eating pace, and some of these symptoms? Well, you said
Yes.
eating too fast already. So, yeah.
Yeah.
What
I mean,
about-
I think the stress connection is definitely there as stress hormones are released, cortisol, it's raising blood sugars. That's, over time, it's gonna work towards, decreasing digestion and just kind of the movement of contents to the GI tract. But then the stress also induces increased acid production. And in that way, there's kind of like multiple means by which like it makes the reflux potentially worse.
And from the nutrition clients that I work with, I've just gleaned that there's confusion around GERD and reflux over, is it too much stomach acid? Is it too little stomach acid? Do I have H. pylori? What's happening? So can you talk about, some of those things you see clinically regarding stomach acid infections, that sort of thing?
Sure. And I guess I would start by saying it's not necessarily a problem of too much acid. It's that the acid's in the wrong place.
Okay.
Right. So but because it's this thought that there's too much acid, the therapy has always been, well, let's lower the acid. And, when you think back to when proton pump inhibitors or PPIs, the common omeprazole or lansoprazole or pantoprazole that, people may be on. When those came out originally, they were intended for, stomach ulcers, which, we, find out were, more or less due to H. pylori infections. And so you want to get those ulcers to heal, you had to lower the acid content because we had already eroded through the lining of the stomach wall. Well, then they just became so commonplace for the treatment of stomach ulcers and reducing acid. Well, now we'll just use them for heartburn. Then they're over the counter, and now people can go on them and then never come off of them. So it was kind of this very slow march to this movement from like, oh well, the problem with heartburn is an acid problem. It's not a reflux problem. In reality, it's a reflux problem. We're supposed to have acid. That's how we digest our food. And if if it's the normal stomach, we're looking at pHs of like close to 2. Water is 7. And the most alkaline thing is 14. So it's harder, to digest your food if you don't have acid in the stomach. Now you can have problems with too little stomach acid. That doesn't necessarily trigger reflux, but it can cause problems with digestion and bloating because you're not digesting the foods correctly, and then that can present itself as similar symptoms. But in reality, when we're looking at, well, what's the problem with reflux? It's that the acid or the enzymes like pepsin or the bile salts have ended up in the wrong place. There's been this movement in the wrong direction, what was supposed to go down and not up.
So what are some of the things we should think about for people that have been on these acid blocking medications for a long time? Are there problems associated with that, or is there a reason to be maybe thoughtful about that?
Absolutely. And there's been a lot of data looking at that, and just to be honest about it, a lot of that data is what we call association data. And so, for the listeners, what that means is that if you look at a group of people who have one issue, how many of them have this other thing going on? And so when a lot of the studies have looked at, if you compare in this group of people that they looked at, who's on PPIs compared to those who aren't on PPIs, what other problems do you see in that group of individuals more so than in the people who aren't on them? And so when you look at those studies, which don't show causation, it shows association. Simply like if you go to Ireland and you count the number of people with red hair, it's going to look great, but that doesn't mean that living in Ireland gives you red hair, type of thing. If you looked at these studies, there's the concern because there's an association between being on PPIs and the development of dementia or kidney issues or increasing pneumonias, increasing rate of hip fracture. And so those are associations, and it makes you scratch your head and say, that's not causal. What's going on? We need to probably explore that a little bit better to understand exactly what's going on. Now, there's other things where you can actually mechanistically explain it, meaning like you can scientifically make a case for what's going on. And so, in essence, a lot of our nutrients require some sort of acid in the stomach to be absorbed. You've got to acid serves the function of changing the chemical structure to a certain extent, and that's what allows certain nutrients like calcium and iron to be absorbed into your bloodstream so that you can then put it in the body where you need it. So if you're not absorbing your calcium and you need some acidic environment to absorb it, then you don't have enough calcium necessarily to build healthy, strong bones. And so that's why for a lot of people, not only is it associated, but the thought is somewhat causal that long-term PPI use is going to decrease your ability to really build strong bones because you're missing out on that calcium. And that's when you end up with it being able to understand like why maybe hip fracture associations are seen in some of those studies. There's also a direct relationship between the use of PPIs and the development of other gut disorders. We have billions of people, of little friends living inside our intestines, helping us throughout the day with our digestion, our absorption, our metabolism. All of the little bacteria and fungus and yeast that are living in our GI tract rent-free, our microbiome, are there for a reason. And a lot of issues can result when certain forces push them in the wrong direction. Not only can that come from bad diet, but it can come from eliminating some of that acid in our stomach, which then allows oftentimes the wrong bacteria to go into the wrong place. And there's what's called small intestinal bacterial overgrowth, or SIBO, which a lot of people who end up on proton pump inhibitors, not a lot of people, that's an overreach, but some people who are on a lot of proton pump inhibitors can end up with this problem because, in essence, the lack of the acid ends up being able to shift that bacterial overgrowth. And so I think for that reason, it's important that people who go on those medications that they be reevaluated. And I can't remember if it was the American Gastroenterological Association, if it was the college, but they came out with their own kind of like de-escalation policy, more so that every 6 months, patients on PPIs, they should be, queried and asked, like, and thought about, like, why are you on this? How are you doing? What are your side effects? Is this something we need to continue, or should we be taking it off? So at the very least, we shouldn't be having people running around just on these things for years without ever anybody asking that question.
Yeah, that's good. Something that came to mind when you were discussing some potential contributors to reflux and GERD, when you were talking about delayed stomach emptying, have you in your practice seen individuals that are on a GLP-1 drug, because we know that can delay stomach emptying? Are they more susceptible to it? I understand that the weight loss would be beneficial, because you also mentioned that weight loss could be overweight or obesity could be a contributor, I should say. So, any experience with that?
Yes, and I had actually meant to bring that up earlier, so thank you for, for mentioning it. But yeah, no, we absolutely see that. I mean, the GLP-1s, I think they're doing kind of amazing things for a lot of people who have not been able to, kind of alter their own, metabolism and chemistry. And there's a lot of people who struggle with it. One of the ways that the GLP-1s work, and it's a function of how the hormone interacts with the body, is it intentionally slows down stomach emptying. And it gives you that sense of fullness. And that's great. If you're full, you don't want to eat. But I think probably almost anyone I've spoken to, whether they're friends or patients who are on GLP-1s, had some amount of fullness, nausea, reflux, heartburn, indigestion, you name it. So we definitely have seen probably an uptick in the number of people who have those issues now, that I think more people than not at this point have found some reason for a GLP-1 to be, effective for them, whether it's their diet or weight, or, there's even evidence for addiction and that type of thing. So a lot of people are up on that medication.
Yeah, so just another consideration, if on one of those meds, of something
Right.
to take seriously, like if you're having those symptoms on a regular basis, because there is some damage that can be done from that and
Right.
needs to be looked at. So that kind of brings us in our next question about shifting into solutions. And so maybe you've got some ideas of hope for people there with how they might be able to manage these symptoms a little bit better. So if someone is dealing with reflux or any of the associated conditions that can go with that we've been talking about here, what are the options, like from conventional approaches to more root cause or lifestyle based strategies? What do you want to share with us there? What can people consider?
The lots of things we can do kind of to have the person help kind of heal themselves from within. I think absolutely we have to start with just looking at a person's basic diet and basic habits. As I'd mentioned earlier, kind of like the high processed foods, high sugary foods, high fatty foods are going to just in and of themselves create more reflux because of the acid that's being generated by them, or the fact that the fatty foods slow their stomach down. So we're kind of recommending more of a lower fat, low sugar diet is going to be helpful. Looking at when people are eating, we generally recommend at least 3 to 4 hours between when you eat and when you lie down. And so kind kind of that more European model potentially of eating at 8 or 9 o'clock at night and then going to sleep is not necessarily going to work if you're trying to battle reflux. So you want to get 3 to 4 hours in between when you eat and go down, but then also in that time staying as upright as you can so that gravity is helping to keep things where they are. A lot of different food choices are going to make things worse for you, including outside of the fat and the sugar, but alcoholic beverages, carbonated beverages, caffeinated beverages are going to make things worse. Caffeine and alcohol are directly going to like loosen that lower esophageal sphincter, the muscle that's trying to keep things in the stomach. Carbonation is going to cause stomach bloat. So you're now adding pressure to the stomach, which is going to help push things up. And then the carbonation in and of itself is acidic. And so while, like I said, it's not necessarily an acid problem, it's acids in the wrong place problem, but adding acid to the problem isn't going to help either. And so, so beer is probably going to be beer and, diet colas are going to be kind of this combination of probably like the worst things that you can consume for that type of thing. We talked about the mindless eating being a factor, and so the mindful eating is the correction for that. Screens down, thinking about the food that you're consuming. I mean, studies have shown that you eat more when you're looking at a screen, and so putting the screen down, tasting your food. That my mom always said, "What 30 bites before you swallow," type of thing. But it's true because the more you macerate the food and break it up, it's going to be easier to digest, but it's also causing you to slow down, think about the food, being present in the moment, not gobbling all of that air by swallowing as fast as you possibly can. And because it's also slowing you down, you're giving yourself time for those satiety hormones to be released and to feel full. So you're actually going to eat less. And in and of itself, that's going to reduce your reflux. Once it gets time to getting to bed, then there are certain ways that you can position yourself to reduce reflux. Simplest basic thing is left-sided sleeping. So left-sided sleeping actually will reduce reflux just by the way it positions the stomach in relationship to where your esophagus is. And studies have shown that left-sided sleeping is better, which is interesting. There's also the thought process in just even like kind of Ayurvedic and traditional like Indian medicine, where just, the left-sided sleeping is better even just for nasal airway and breathing. And so like there's a, kind of a interesting connection there from multiple different levels. But left-sided sleeping, beyond that, it can be elevated sleeping. And so whether you raise the head of your bed up on stilts so you can get like blocks to actually raise the whole bed, or there's ramps or elevated pillows that are going to position your body in a slight incline. What I always make sure to tell folks is don't just put 3 or 4 pillows under your head and you end up just kind of hunched over, crunching your stomach, actually just compressing things and making things worse. You're really looking to create that ramp, that gradual incline, so that again gravity is playing a role. And then in addition to that, kind of like mindfulness while eating, kind of the meditation, the gratitude, the journaling, whichever way you want to think about executing that in your life, but like just that way of kind of centering yourself, reducing your stress, slowing yourself down, approaching the day in kind of a less chaotic way, which becomes harder and harder with every day. And for me, that means never watching the news. But it's, there's all the ways to kind of like attack it from that mindset of trying to like reduce the stress and get yourself to a better place, and having that not be a part of the contribution.
An otolaryngologist talked to me about digestion so thoroughly. That's amazing.
It's a passion of mine with me and my patients, and it's a lot of my colleagues from around the country in terms of your nose and throat are like, how are you doing this? Like it's important.
Yeah.
And if you're missing this, you're missing most of the patient.
Yeah, when you were explaining all of that, and thank you, I was thinking about how this is the things that Krista and I have been talking about forever. And the tools that you provided to help with reflux and GERD are just so important for overall health. I was thinking, oh, that applies to, blood sugar management, metabolic disease, all of these different things, which is really, I think, for people to know that they don't have to do. It's not you gave us really, I'm not saying easy, but simple things that really cover so many bases, I guess what I was trying to say, and things that Kristen and I talk about all the time. So, a more whole foods diet with lots of fresh foods and lower fat and lower sugar, and to, stop eating 3 to 4 hours before bed, watch the alcohol, the caffeine, the beer, being mindful and present with your meals. All of that is really helpful for just overall health. So I love that message that you're giving us.
Yeah, it's awesome. You know, we also know that you personally have a very interesting approach with the product that you've developed, and we'd like to hear more about that. I have a couple of clients right now that are utilizing it. It's called Reflux Raft. So can you tell us about that and how that came to be and how it works?
Absolutely. Reflux draft is an alginate based product. And so what alginates are technically it's a polysaccharide or a fiber that is derived from seaweed, brown kelp, technically a type of algae. And the unique property about these alginate fibers is that when paired with just the other ingredients in the stomach, when it reacts with the stomach acid, it actually forms a gel. And that gel, kind of like almost like a jello, then will rise and float on the surface of what's in the stomach and actually prevent reflux from occurring. So it creates kind of this mechanical blockade. So there's a little bit of calcium, some carbonates, bicarbonates that are added in with the alginate, and that creates this just fancy chemical reaction that then turns this kind of thicker liquid into this gel that sits there and more or less kind of corks off the esophagus and actually reduces the reflux from actually occurring without adjusting stomach pH or those types of things. Alginate is something that's kind of been around for decades, and there was a product that had come out in the 1970s. And I was learning about it, more recently, and I was speaking with one of my colleagues, what they were using for, a lot of their voice and chronic cough patients. And we were all like finding this alginate at the same time. And we would recommend it to some of our patients. But a lot of the items that were potentially already available are either high in preservatives, high in sugar, uh, high in the things that I'm finding none of my patients have. And so we decided to make our own, and that's when Reflux Raft was born. And in a kind of a parallel way to how I thought about, or how we think about PPIs, are kind of just attacking kind of reflux from a very unidimensional way, and we're only at the acid. Alginates are great, and they're working in a different adjunctive way as well. They're blocking the reflux from occurring to support other functions that the body needs to try to like heal itself, and reduce the reflux. And so we wanted to kind of create enhanced reflux product or an enhanced alginate so that it's kind of helping to support the body on different layers and to provide symptomatic relief. And so we've got a couple of different formulas with the reflux draft, and the initial one with ginger and the glycerinated licorice or DGL. And those ingredients were chosen because the DGL is a nice soothing gel that helps to kind of coat areas that may be more irritated. And the ginger has been used kind of centuries as an anti-nausea agent, anti-inflammatory agent. And in truth, the ginger works because it's kind of a kinetic agent. So it helps promote like natural peristalsis and movement of the stomach to move things along. And that's why it can help with that. And so um, that was our approach with Reflux Raft. And we've been received very well by, patients and customers alike.
Sounds like a really interesting, more natural way to try to address the issue, which is the acid getting in the wrong place versus what you said, just trying to suppress the acid, which doesn't really help you overall in terms of digestion and long-term health. So that's a great option. If someone was, thinking they wanted to try that, but they've been on a medication for a long time, are there some caveats that you would say, or a way to go about doing that safely so that they don't make their symptoms worse while they're trying to make them better?
Yeah, absolutely. I mean, and I think, the major caveat too is, without knowing why somebody may or may not be on, some other acid lowering medications, it's very important to check with your healthcare provider to, better understand whether or not tapering, those types of medications make sense. If you've got Barrett's esophagus, if you have H. pylori and stomach ulcers, like that's not a person that I would say should be looking at trying to taper your PPIs until that kind of disease process has been addressed. But as many people who have ever tried to taper a PPI knows, the acid reflux can be astounding afterwards. And there is a definite rebound process to that. And so, in just the same way that we talked about all these other holistic ways, if you're coming off of a PPI, it should be kind of a organized, tapered process. But the ways to support that can include like all the things we talked about in terms of diets and those things, but then also a function of using the alginates can be done as an adjunctive measure to help like relieve symptoms and then help to prevent the reflux from actually occurring. The alginates only last for about 3 to 4 hours before the body breaks them down and kind of passes them along. So it's not a take it once and you're good for a 24-hour type of thing. So we have a lot of people will take them after meals and again at bedtime. They can be taken symptomatically. So if you're having heartburn or indigestion in the middle of the day and you haven't eaten anything, it can be taken on the spot. And the studies show that, the alginate-based products work pretty rapidly in terms of providing symptomatic relief. And so then that can be used in that way to, help taper those PPIs down.
We just want to make sure our audience is just clear. If this might apply to you and it might be something that you're considering, you want to make sure you're working with your healthcare provider to help taper you appropriately or even consider it. Make sure your situation's considered first. So, but love the fact that we may have a more natural option here to consider and put in the equation. It's awesome. So Diana, did you have any other questions?
No, it just, I love this conversation because it feels so doable. You gave us so many actionable tips and simple tips, and I not easy always, but really simple tips, and explained it in such a way that I feel like our audience can really understand it. And also, I like that you dispelled some myths because there are a lot of misunderstandings and myths around this. So thank you for that.
Yeah. So as we wrap up, is there one thing that if somebody was listening out there, you wanted them to take away from this conversation, what would you want that to be?
It would be that, just because you don't have heartburn doesn't mean you don't have reflux. And just because you have reflux doesn't mean that you have to be on a PPI. And that there are a lot of things that can be done to provide relief. And it just requires partnering with the right people to get that information into your hands.
Excellent. Where can people find you if they want to learn more?
They can find me online, and our product is at refluxraft.com. And, if they want to connect with me, they can shoot me an email, as always, great, Spencer@refluxraft.com, or, they can hit our website and complete a form and ask us questions and check out our products.
Well, Dr. Payne, we can't thank you enough for your time. You're a busy man and with, busy practice and lots of children. So we really, really appreciate your time and your expertise. And thank you to all of you in the audience for joining us. We always appreciate you being here as well. And we can't wait to see you next time. Take care.
This episode of the Nourishing You podcast was brought to you by Leucofix. Learn more at www.leuco-fix.com. Don't miss a beat. Find other episodes and subscribe to this podcast on YouTube or check us out on your favorite streaming app. Now available on Apple Podcasts, Pandora, Spotify, iHeartRadio, Amazon Music, and more. You can also visit nanp.org for more information. Looking for a board-certified holistic nutrition professional to support you on your health journey? Go to nanp.org to get started today. Membership in the NANP provides you with a competitive advantage. Whether you're a current practitioner or a student, we want you to become an active, informed leader of the holistic nutrition community and join our association today. When you're ready to go a step further, you can boost your credibility by becoming board certified in holistic nutrition. Visit nanp.org today to apply. The information on the NANP podcast is for educational purposes only and should not be considered medical or legal advice. The NANP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NANP and all agents. Copyright NANP, all rights reserved. Until next time, stay nourished.